1320 WILS, of course, online, 1320WILS.com. Podcaster there. You can join the TuneIn app and listen anywhere, anytime. Of course, we're live streaming 24/7, 365. And always interested in continuing the conversation when it comes to healthcare and health benefits and how we're accessing those or not accessing those these days and what's happening in terms of the cost. There is a mindset out there that under Obamacare, the Affordable Care Act, that all that's happened, this is critics will say, all that's happened is that there's been a cost shift in America, and the cost shift and the growing cost of medical care has been transferred directly to patients themselves with a higher deductible, a bigger copay, provider networks drawn down, and that sometimes you have to go outside of your network just to get your care, not because you want a particular doctor, just to get your care, which is the opposite of what you do having insurance. And what's the point? Well, what is the point? Health benefits expert Ed Hodgson is here to join us and discuss this morning. Good morning, Ed.
Good morning. How are you?
I'm doing fine, thank you. Hope you are as well. Do you find this is the case? Is this accurate?
Yeah, I think it's very accurate. In our business, we work with companies and we deal directly with employees.
Right.
I think everybody has sticker shock right now. To your point, the deductibles have gone up drastically. Co-insurance has gone down. And, the simple point is there's nothing affordable about the Affordable Care Act.
So this wasn't supposed to happen. If that's the what of what's happened, how about the why? Why has it happened?
Well, there's a huge shift. So for the insurance companies, obviously, they could no longer medically underwrite, so based on risk. So you had a huge flood of people, rightfully so, that never had access to health care. They got it. They have extensive medical conditions. Those have to get paid for. And so the insurance companies, not knowing how many people are coming into the marketplace, had to shift the plans to try and make them more affordable. It's crazy to go into a company and tell somebody that their monthly premium to cover their family is going to be over $2,000, and that's what's happening.
So if people are getting help, excuse me, if they're getting help with their premium with subsidies, are they still prepared for what they're going to get hit with in terms of these deductibles?
No, absolutely not. The providers out there are, if you're going in for a procedure and they see that you have, a $2,000 deductible, but there could be another $1,000 copay attached to that, they want you to prepay that. Well, most people don't have $3,000 sitting on hand to pay for these procedures. So I think for, consumers, they're very confused because, the plans are even more confusing now than they were 5 or 10 years ago.
And people used to think that there was a lot of confusion when the Medicare Part D drug benefit came out, but now that's starting to look like the most clarified and easy to understand of the various things out there. It's rolled into form after these number of years. The confusion is with everything that surrounds that now in Obamacare, or am I off base on that?
No, I think you're exactly right. I think, for people now, they don't even realize that individual health insurance, it's only offered once a year now. And let's go back a little bit further. The days of the $5 copay and everybody was complaining about HMOs, that doesn't sound bad now.
No, not really. So where are we going with this down the road in terms of, and we're visiting with health benefits expert Ed Hodgson this morning. Where are we headed with this? Is this headed towards a breakup where, I guess it can go two ways. At some point there could be repeal. We've heard a lot about that. Yeah. Or we could be headed towards a single payer, or is it going to be something else? What do you think?
Well, that's a great question, and I wish I had a crystal ball and I could answer, that question. I think that it's obvious that to a lot of people that repeal is not going to happen. This is the single largest train that's left the station, and billions of dollars have been spent with the insurance companies trying to redefine sort of where they sit in the marketplace. Then you have all the medical service providers out there. And so everybody plays a really key role in trying to determine where this goes. I think at this point, what everybody wants is something that is acceptable, that is affordable, and in the event that they have to seek medical services, that it's not going to cause them to be bankrupt. So I think if anybody can answer that question right now, they would they would be able to read fortunes. But I certainly think that nothing is going to change in the very near future.
Well, you know what? You may want to file. You may want to get something filed on this if it wasn't for the fact that there's branding and marketing and lawsuits. Just calling it AAA. Because I got one more for you there. You said acceptable, affordable, and how about available? And if you could assure those three things, you're probably going to have a healthy consumer in terms of health benefits. But we're not there yet, are we?
We're not. We're not even close.
So Ed Hodgson is our guest this morning, our expert here, and we weren't going to hold you to that, but the fact that you're not willing to go out and say where is this headed means it's murky now, isn't it?
It's very murky. I think that right now people are just trying to hold their head above water, trying to figure out what's best for themselves and what's best for their family. The insurance carriers are doing the same thing. This is new territory for them. Obviously, you've got the medical service providers as well out there. So I think everybody's trying to sort of figure out what the best solution is. I can say that what we have in front of us right now is not, even though it has provided a lot of people access to health care with subsidies, and that's good for them and their families. But for the rest of us that are being hit with huge increases, it's a difficult time.
Ed Hodgson, where do we find you online?
You find me at www.synergybenefits.com. That's SYNERGY, benefits.com.
Synergy, as in, I think we used that word, some synergy overall.
Yeah.
Not a bad thing overall. Ed Hodgson joining us this morning. Ed, thank you for being here.
You're welcome. Thank you.
All right. We have more coming up on it. Well, he sounds a little downbeat about that overall. I guess, we'll see. But the question remains, as he kind of laid it out there, if the stuff is available, is it affordable? Is it acceptable? If it's affordable, is it acceptable, and can you get it? And if it's acceptable, is it something that it's not going to break the bank and that, again, is available to you? Finding all three of those things to align so far has been difficult for many, and others are paying the price. It has certainly not been a case of perfect, and I think we knew that going in, but it's becoming more clear right now. And there are differences of opinion on that in general. More ahead on the Morning Wake Up. Don't go away. This is 1320 WILS.